have very good news this morning. We only have 3 new cases. 2 of those are overseas acquired and appear to be historical cases. We have 1 new locally community acquired case. This is a close contact in relation to the north side cluster, and this person has been in quarantine since the 27th of March. Their first test was negative, and now they have become infectious and they are now positive. So the good news is the lockdown has served its purpose in that the people that we were tracing have been able to be quarantined before they've got infectious, which is exactly the purpose in which we sought to have the lockdown and allow our contact tracers to do their job. Thank you to all the Queenslanders who have come out and got tested. We've had 25,837 tests in the last 24 hours. We want to see those test numbers stay high. If you have any symptoms whatsoever, please continue to get tested over the Easter period anywhere in Queensland. We have 74 active cases. I'm pleased to say we had 11 discharges in the last 24 hours, but 74, of course, is still very high, and we are looking after those people in our hospital system currently. I also want to say how great it is that we've had so many people getting vaccinated in the last week. We've had 29,123 vaccinations done in the last week. This has put us now over 88,000 vaccinations, and we look forward to continuing those high numbers as we go forward and move into the 1B group. I'll hand over to the Chief Health Officer now to just talk about those cases.
Thank you very much, Minister. So 1 new case overnight acquired in the community. This is a gentleman who attended the Black Hops Brewery on the 20th of March and then was placed into quarantine on the 27th of March when we became aware of the outbreak. He tested negative on the 27th of March, and then he's become unwell and has now tested positive while in quarantine. So that's perfect. He's been in quarantine for his entire infectious period, so there is no risk here at all. So I'm very grateful for those over 2,000 people who've been in quarantine as a result of these recent 2 clusters. That's been very, very important. We never know which is the person who's going to end up infectious, but here we have one who's been in quarantine, so that's ideal. So thank you to all of those people, and thank you to the people who've been working so closely with our contact tracers. They've really given us so much information, and we've got that up there on our website. People should be reassured by the large numbers of venues that are up on the website, because that's the information we need. They shouldn't be concerned that there are so many. But please, could everyone continue to look at those at the website, look at those venues, particularly if you've been in any of those more distant ones, so that the nurse who tested, who was positive, who was a positive case and is now tested negative, was infectious during that period. So we're asking anyone who attended any of the venues she was at to please come forward and get tested, and also anyone in their household who's become unwell. It's very important they come forward and get tested. So we've seen a lot of testing again yesterday. That's really, really good. Please, it needs to continue for the next 14 days while we just work through whether there's any ongoing risk. It's very reassuring where we are now, but we do need that extra testing, and we do need to continue with the restrictions. Thank you.
Dr. Young, are you worried about the AstraZeneca jab? There was reports from Melbourne yesterday about lost bodies in there.
That's true. Yes, there have been some reports around the world that are still being worked through, and there has been this report of an individual who received the AstraZeneca vaccine and then was admitted to hospital subsequently. So the advice from the Chief Medical Officer, who gave that advice yesterday afternoon, is that if you become unwell 4 to 20 days after receiving the AstraZeneca vaccine, it's very, very, very unlikely, but if you do, then you should seek urgent advice. That's important. We know that all vaccines have some very, very rare side effects that can be serious, And we know if we're giving the same vaccine to large numbers of people across the whole world, we would expect to see those rare side effects because we're giving the vaccine to millions and millions and eventually billions of people. So people just need to be aware of any symptoms and just come forward if they do have them.
Will we be suspending the rollout, or are you changing the advice for any groups?
Right, so AHPPC met yesterday, so I met with all of my colleagues at AHPPC yesterday. We're going to be meeting again today, and more importantly than that, TGA and ATAGI, the two important bodies involved in looking at this, TGA from the regulatory side and ATAGI from the health advice side, are urgently meeting and talking. So we will get more advice from them at our meeting today, and then a decision will be made as to what advice should be provided. But at this point in time, people shouldn't be concerned, and we expect rare side effects. We just need to be aware of them, and individuals need to be aware of them.
Do we know yet, in terms of the second cluster, how that nurse caught the coronavirus?
Yes, we have genomic sequencing results for the second cluster, so it was from the same individual from India, the same patient.
And are there enough pressure into the public at the PA at the moment?
We're not putting any more COVID cases into the PA at the moment, just till we try and work out how this has occurred, because the first patient that led to transmission and the second patient that led to transmission were both being managed in the same room, subsequent to each other, not at the same time. So we think there could be a problem with that particular room or the environment around that room.
Can you expand on that? Like, are you suggesting that the virus might be in the air or something?
No, I don't know at this stage, but it's suspicious that both of those, it could of course be coincidental, but it is suspicious that both of those patients were being managed in the same room, one after the other.
What's the testing regime for these nurses? How come the testing that she was sick? She was sick for quite a bit of time, or she had the virus?
She was never sick, and that's the issue. So for the vast majority of cases, I do just recommend that if you've got any symptoms at all, come forward and get tested. We do know that you can get this disease without any symptoms and then pass it on. But that's actually less common. The most common is that you will have symptoms. And we can't have the entirety of the Queensland population getting tested all the time without symptoms. That would be ridiculous. So the process is, if you have any symptoms at all, please make sure you come forward and get tested. Then we do look at close contacts, like this gentleman that's just tested positive, the most recent case. We look at close contacts, and when they go into quarantine, whether or not they've got symptoms, we test them at that time. Plus, of course, we look at household contacts who are close contacts as well, and we test them. But usually the advice is, if you have symptoms, come forward and get tested. So in terms of the hospital, we did work through with the hospital at that stage to test staff, but at that stage they were really concentrating on the doctor who got infected, and they were testing all of the people around the doctor. They hadn't realised that there was an ongoing potential risk from that particular patient, which is why they didn't expand their testing to a broader cohort. They've now done that, of course. So now anyone, visitor or patient or staff member who's been in that ward 4D, 5D, I apologise, over that period is getting tested, whether or not they've got symptoms. So that's occurring now.
So to clarify, just at the PA, the people that are being treated there, are they all in pressure rooms, or are some of them not in pressure rooms?
They were all in appropriate rooms at the moment, but we had to move them out of 5D because I wasn't sure what the route of transmission was. We've actually moved most of them. I haven't got the latest information this morning, but we've moved most of them out of the hospital, so they're not there at all.
Just to clarify, before this outbreak happened, people working in this
It was variable. So I've now brought in a policy that all workers working with COVID positive cases must be tested every shift, no different to the hotels. Now, we didn't put that in initially because, of course, these are highly trained people, and we've done exceptionally well until we started seeing these more recent variants that are just so much more infectious. So although these are highly trained people, they know how to use PPE, through no fault of their own, we've now seen transmission. So I have now required anyone working in those wards who has direct linkages or contact with any COVID positive patients that they must be tested every single shift. This is an enormous imposition on all of those staff, and I'm very, very grateful that they're able to and prepared to do this.
Dr. Young, do you have concerns about the unfolding crisis in PNG, and how is that still impacting our system?
Yes, I'm very concerned for PNG. This is terrible for PNG. They managed this so well until recently. And again, it's because the virus is changing. It's just now got out into their communities, and as we always suspected might happen, it's spreading very, very quickly. So it is an enormous concern. For us here, I'm not concerned. We have very good systems in place. We're rolling out the vaccine throughout the Torres and Cape. We know when these people come into Queensland, they're going into hotel quarantine, or they're going directly to our hospitals if they're particularly unwell, and so we're managing them. So it's not an increased risk for Queensland other than the fact that we're seeing larger numbers. So our numbers are down again a bit today, which is good, but they have been up to 84, which is it is a stress on the system, but we're able to manage it. We do have the capacity for it.
And the number reducing overseas arrivals for a longer period?
Yes. And today, as you saw, we only had 2 in hotel quarantine, and those are probably both historical cases. So yes, we expect over the next 2 weeks that those numbers will reduce.
But the majority of people coming from PNG, are they FIFO workers?
No, they're all sorts of workers. Yeah, all sorts of people. And of course, we're providing assistance to our nearest neighbour. So when they've had severely unwell people, we've been accepting them. And indeed, one came into this hospital here at Redcliffe. Their intensive care unit has managed one of the patients from PNG.
Dr. Young, do you think that people understand the requirements in terms of whether they're medically exempt from wearing a mask? Are you finding that people are understanding what makes them exempt?
Look, this is really, really hard, but can I say that Queenslanders have done brilliantly. I do not want anyone to wear a mask if it's going to compromise them. And that is the person who needs to make that decision. People know their own health issues. So if someone does have asthma and struggles with their breathing, or chronic obstructive airways disease, or heart disease that they can't get the amount of oxygen they need, they know that. So I don't need them to go and see their doctor and have to have that conversation because they already know it. So if anyone has any problems at all breathing, they should not be wearing a mask. This is not about causing other problems. This is about preventing the spread of COVID. If someone genuinely, and they will know it themselves, believes that they have a medical condition, then that is enough for me and it is enough for everyone out there. So please, people, it's been wonderful to see people encouraging other people to wear masks. That's really good, but just be a little bit careful that there are a significant proportion of our population out there who can't wear masks safely. As well, children. So some children I've seen out in the streets are wearing masks and wearing them very appropriately, and that's great to see. But any child under the age of 12 is not required to wear a mask. If they wish to wear a mask, of course, I would not stop them, but they're not required. So this is really important. So thank you, everyone. And I can see here today, I don't have a mask on, but otherwise everyone has a mask on because not only are we gathered, but we're outside a hospital. That's really important. And hospitals, aged care, disability accommodation services, and our prisons are really important places. If you can't wear a mask, really consider whether you need to go to one of those 4 places. Unless, of course, you're going to a hospital for medical care. Of course, if you can't wear a mask and you need to go to a hospital for your own care, then go to the hospital.
How many doses of the vaccine do we have, and when is the next delivery?
I don't have that information on me. I'm sure we can provide that, so we'll provide that later today. I just don't have it. I haven't received it yet this morning. Thank you very much.
So we've on Thursday received a delivery of Pfizer. I know we've also released some AstraZeneca, but we've received a delivery of 25,000 doses of the Pfizer. That we've been advised will have to last us for the next 2 weeks. Remembering that we've done over 21,123 vaccinations in the last week, and we've got now 25,000 Pfizer on stock for the next fortnight. So I suspect most of that Pfizer will be used for second vaccinations, because everyone who has already received their first vaccination of Pfizer will need this second dose.
So it's not going to help with the backlog of frontline workers?
Well, let's be clear. We don't have a backlog. We are exactly on track to deliver our vaccinations as we planned. We have practically completed the 1A group. As I say, that will always continue to be added to, so it'll never completely finish as new hotel quarantine workers come on, as our paramedics and police and our health workers change shifts and put new staff on. We will need to continue to vaccinate that group. But we have had practical completion, and we've hit critical mass of all of the 1A groups that we can bring the protocol in place that says no one can work with these COVID patients anymore unless they've had their first vaccination. So there isn't a backlog. We're moving on to 1B, which is the rest of our health workforce and other frontline workers, including emergency services, the broader police force, our fireys, of course, all of our correctional services as well.
Do you say people who suggest that the government hasn't been transparent about this rollout?
We have been as transparent as we possibly can. We release our vaccination numbers every single day, as we have released our COVID numbers every single day. I'm very proud. We set ourselves a target of getting to 20,000 a week by mid-April. We've now hit almost 30,000 this week. That's incredible, considering that includes a public holiday, so we didn't have all of our centres open yesterday. So I'm really impressed that we hit almost 30,000, and we're over 88,000 in total now. That's exactly where we plan to be. And remembering, we have on average no more than 2 weeks stock on hand at any one time. So we have to work with the supply that we have. If we were to race out and set up a mass vaccination centre tomorrow to fast track all of our health workers, we would run out of the vaccine in a couple of days and still have to wait for the next delivery.
Do you know when on Thursday you received the vaccine supply? Because Stephen Miles said that there was only 3 days left on Thursday.
So we got a delivery on Thursday. So we did have 3 days supply as at Thursday, and then a new delivery came, which was 2 weeks supply of Pfizer.
Where are we up to with international arrivals, and why is it so important to reduce that gap?
Well, we're already starting to see our positive cases come down, which is really good, and we believe that part of that is because we have reduced the number of international arrivals. We know that every week we are getting more positive cases out of our overseas arrivals. That puts pressure on our hotel quarantine system, that puts pressure on our hospital system, because we are moving all of those positive patients into our hospital system. We welcome the decision that the Prime Minister initially made in agreeing to reduce or halve the intake for a fortnight. The Premier has written to the Prime Minister asking for that to be extended at least till the end of the month. We haven't heard anything back on that. And also to consider how many we should be taking until we get a broader rollout of the vaccination. We do have to keep managing this. This is a very fine balance at the moment between moving into the vaccination rollout, but still acknowledging we are getting positive cases coming into Australia. And in fact, we're getting more positive cases than we ever had before, far more than what we were seeing last year. So we do have to manage that. and that's why that conversation is happening, and that's why the Premier has reached out to the Prime Minister on our overseas arrivals. Can I just also mention that we are expecting a fair bit of rain over the next couple of days, particularly everyone returning back from the Easter long weekend on Monday. Can you be very careful on the roads? If it's flooded, forget it. Please don't risk your life and those of your family to get home quicker by driving through floodwaters. So we may see localised flooding. Please be aware of that. Keep an eye on the weather reports as well.
Should the international arrivals be halved for the entire country or just Queensland, do you think?
Oh, look, that's up to other jurisdictions, but what we're saying is that we have just seen 2 clusters here in Queensland. We have followed it by a textbook. I am so impressed with our health workers, our contact tracers, with the Chief Health Officer's advice on how we should respond to this, and of course how every Queenslander has responded and responded quickly. But we know the risk. We're still seeing new waves of infection overseas. So we cannot be complacent, and we need to be mindful that we are trying to manage the vaccine rollout with the same health workforce that's got to manage our hospitals and our hotel quarantine and our testing clinics. It's putting a lot of pressure on our systems, and we ask that the Commonwealth consider this, and I have no doubt that the Premier will raise this in National Cabinet next week as well.
So what are our numbers currently out with the arrivals now?
650. It's been half too. Yeah.
So what do you say to people who refuse to wear a mask and they need police at night time when their masks should be on?
Look, we understand that people don't want to wear masks. This is not our normal environment. This is not what we're used to doing. But it is a small price to pay for keeping Queenslanders safe. Look at what is happening overseas. We've had millions of deaths. We've had millions of people who have been positive with COVID who have ended up with long-term health conditions. This is not something to be complacent about. We ask that everyone be respectful to our frontline officers, our police, our compliance officers. I heard of abuse on Friday of our health workers because people were upset about having to wait for vaccinations. Can I say, these people are working every single day to keep us safe. So don't abuse them. Be respectful. They are there to do a job. They turn up each and every day to keep us safe, and I am extremely grateful. And all Queenslanders should be grateful for the work they do, including our police officers. So there shouldn't be abuse. There shouldn't be spitting, and people should remember we changed the laws. Spitting, coughing on someone while you claim to have COVID is a criminal offence now, and the police will charge you.
Is that like a hard for police? We've got the Chief Health Officer saying, I don't want anyone to wear a mask if they don't need to. Police have obviously got to enforce those rules, but people don't have to provide any evidence.
The police have worked with the community from day one. If someone is legitimately claiming they've got a health condition, I have no doubt that the police will be listening to that. But some people are just being belligerent. Some people are just outright refusing to wear a mask, refusing to accept a free mask from the police, and they're refusing to give their contact details. That isn't on. That's not acceptable. That is very different to someone who has a legitimate health condition.
Given that this community transmission vaccine today has been mishandled the virus since the 24th century, contracted it, is there some concern that some people will get a test, get it back negative, and then still develop the virus?
That is why, that's a very good point, that is why we require people, although they've had a negative test, to then remain in quarantine for 14 days. So that's the whole process behind hotel quarantine, that people get a test when they first go into hotel quarantine, and although it may be negative, and in most cases of course it is, they have to stay there the full 14 days. And that's what happened with this gentleman. He attended a venue that was of concern on the 20th of March, so when we became aware of this cluster, he was picked up through contact tracing. He had a test done then, it was negative. Then he had to spend 14 days in quarantine, which is done, and it was day 12 that he became positive. So that's why we have 14 days quarantine in place. That's why it's not enough to just be tested and then go about your normal arrangements. Unless, of course, your exposure was more than 14 days ago, which is what is happening with this recent alert that we've put out. So we're asking people who've been in the venues between the 10th and the 23rd, because that's when we know that nurse was infectious, to get tested, and they won't necessarily need to quarantine for 14 days because we're already past the 14-day period.
So if some of that things that so others might not pick.
No, because that's why we do contact tracing. That's why we go out and find people. But can I say that the vast majority of Queenslanders have done exactly the right thing. We're having people come forward when they see that a venue's been involved, and they're coming to us rather than waiting for us to go to them. But we will get to them, so that's what the contact tracers do. But our aim, and I do apologise to the businesses, because many times now we're getting the venues up on our website before businesses are even aware that there's an issue. So our aim is just to get information out there as quickly as we possibly can. So if everyone could keep looking at that website as more venues get placed on it. Thank you. Thank you very much.